signs, how we can collect the vital signs from the particular patient. So vital signs, we need to understand the parameters. How to get? We need to understand the parameters so that when you receive the patient, when you see the patient for the first time, we can get the vital signs. These are the ones that will lead us now to proper health assessment. Okay? You cannot send the patient to the ward without taking the vitals. So you're supposed to take first the vitals, then that's when you can send the patient to the ward. The patient may be on the ward, right? The patient may be on the ward and you're supposed to take vitals. So depending on the condition of the patient, vitals are taken 4 hours. How to get? We take vitals 4 hours. So every after 4 hours you're supposed to take. But depending on the condition of the patient, probably the doctor will prescribe. So we will say you're supposed to take vitals every after 2 hours, or every after 30 minutes, or every after 15 seconds, depending on the condition. For example, during blood transfusion, every after 15 seconds you are taking the vital signs. Why? Because a patient can react to what? To that blood. The other thing, the patient who is coming from theater, you're supposed to be taking, if the doctor said every after 30 seconds, 30 minutes, you're supposed to take the vitals so that we can change. We can see and check the end deviation from normal. The other thing that we need to understand about the some vital signs is that these vital signs, they act as baseline data. You can receive the patient in the morning, and in the evening the patient does what? The condition changes. What are we going to do? We have to check what time did we receive the patient and what has happened. How are the vitals ranging? Are they ranging from normal to abnormal? Or they are ranging from being normal maybe to something else? So those things, they are going to help us and make sure that we maintain the nursing care for this particular patient. So now, the vital signs that we take, number one, we have the temperature, we have the pulse, we have the respiration, and we have the blood pressure. Now, this doesn't necessarily mean that this is what you can only get from the patient. You are supposed to get also the height. If this is the first time you are seeing the patient, you're also supposed to take what? The height. How to get the weight of the patient. The height and the weight of the patient are going to help us also to know, is this patient feeling well? Is this particular patient having an underlying condition? Is the patient malnourished because of the weight, isn't it? And the other thing that we can also take is the pulse, the oxygen saturations. Now, oxygen saturations, we get them. The reason being, we need to know how much oxygen the patient has in the blood. We understand that oxygen is carried by the red blood cells, right? Okay? So if it is carried by the red blood cells, it means that oxygen which is being carried by the red blood cells, using the hemoglobin when it attaches itself. Now we want to know how much oxygen is within the body. And once we know the amount of oxygen that is within the body, it is going to help us to understand what we need for this particular patient. How to get it? So the normal ranges for these vitals, they are also in the normal ranges. So number one, when you're talking about temperature, temperature is supposed to be taken on admission. Hello? Just on admission, you're supposed to check the temperature. While the patient is on the ward, you're supposed to take the temperature. Pulse, respiration, and blood pressure, all these things, we are supposed to take them while the patient is what? Is there, or the patient is admitted. So during admission, we take. The other thing, it's routine as inpatient. Inpatient, it means the patient who has been on the ward. Okay? Then the other thing is before, during, and after surgery. Before taking the patient for surgery, we are supposed to take the vitals. We need to know the kind of a patient we are sending to the ward to see it. During surgery, as they are operating on the patient, we are supposed to know how the patient is faring because the patient is under anesthesia, and we need to understand and know how is the blood pressure, how is the pulse, is the patient responding, okay? The other thing is after surgery, when the patient is coming from surgery, okay, that is now post-operative care. So under post-operative care, we are supposed to take the vitals and see how far or how is the patient responding, okay? The other thing is during and after blood transfusion. Blood transfusion, when you understand it, this is why we are giving the blood to this particular patient, right? Now, we want to understand and know what are the vital signs, how is the temperature. Before we transfuse blood, well, what is the temperature of this particular patient? The respiration, the pulse, and the blood pressure, the oxygen saturation, how are these ranging, okay? During blood transfusion, we are supposed to continue after 15 minutes. We are supposed to continue taking the vital signs. Why? Because the patient may react to that blood. And once the patient reacts, you will find the patient starts having maybe rash, or the temperature does what? It increases. Just know that the blood is not compatible for that particular patient. Even after blood transfusion, we are supposed to continue so that there are no cases. You will understand that nursing care is what is making the patient to do what? To survive. The patient who is coming from home is not supposed to die. Unless things just get worse, or maybe later takes its course. But in as much as we can receive the patient on the what? The patient has come to seek what? For care, and we are not supposed to kill the patient. We are not supposed to not to give the care to that particular patient. So principles, number one, when you're taking the temperature, principles number one, we do not take the temperature on a patient who is just coming from taking a bath. Imagine the patient was taking a bath with cold water. Then you want to take maybe temperature. The temperature will not read properly. You are going to have a false temperature. So what we do every after 30 minutes, when the patient bath, after taking the bath, after 30 minutes, that's when you do what? You take the temperature. When it comes to the mercury, if you are using the mercury, okay, let me show you the mercury. So this is the mercury thermometer, okay? It looks like this, it's not a pen. So when you are using the mercury thermometer, this is the mercury thermometer. So you have to shake it so that the mercury you are seeing here has to go down below what? 35 degrees Celsius. Are we together? Yes. Good. Then if you are using these others, you can just clean them. For example, the digital one, you just have to continue with the procedure. Then the other thing is avoid taking oral temperature after cold or water things. There are those thermometers that we use for the oral, okay? Now, these are contraindicated, especially in pediatrics and psychiatric patients, right? Because a psychiatric patient will feel like it's food, and they will just buy the thermometer. A child, you know, when a child is growing, the child is learning everything from the start. So whatever goes into the mouth, they will just grab and stand now chewing. Now imagine chewing mercury. Okay, so we avoid. And if the patient is coming, maybe was taking maybe some tea or some cold drinks, we don't take the oral temperature, isn't it? The other thing is clean the thermometer with soap if that is the first time. Okay, now in the medical setup, the things that you are going to use on this particular patient should be for this patient. But now you'll find that you are using the same thermometer on different patients. You are supposed to use what? Spirit, methylated spirit, which is not expired. Okay? Then the last one, rectal temperature is done in newly born babies. When the baby is born, that's when now you can take the rectal temperature. Are we together? And severe malnourished patients, those severe malnourished patients, we can use the anal region or the rectal region to take the temperature, okay? So now what do we need? What we need for this? Number one, what we need on the top shelf of the trolley, first thing first, you will get the permission from the ward teachers, right? I need to take vitals. After getting the permission, after you have done the hand washing, the next thing you are going to the treatment room, isn't it? When you go that side, that's when now you are going to get now the trolley. You clean it surgically. And you remember when cleaning surgically, you are using what? Spirit, isn't it? The way we down dust, isn't it? From furthest to the what? The nearest, is it right to left, isn't it? Then from top to bottom. When you are done with that, that's when now you start now putting these things. Garlic pot with 3 cotton swab. We have the garlic pot with 3 cotton swab, right? Can I have an assistant who will be lifting, who can just lift that? This is the garlic pot which has cotton swab. Can I have one? Okay. So we have the garlic pot with 3 cotton swab, isn't it? The one, yes, that is now the garlic pot with 3, the cotton swab. Then we also need a bowl with gauze swabs for cleaning the what? The axilla. The axilla is the, can we say the armpits? And avoid taking temperatures, please. When we are nursing these patients, we need to make sure that, you can take your seat. We need to make sure that everything on the patient, we need to shave the patient if the patient is unable to shave, isn't it? Encourage them to have that hygiene. There's no way you can be taking the temperature. when you find that the axilla, the armpits are very dirty. How to get? Okay? Then, gallipot of water, so we need to have gallipot of water. We also have the second watch. Okay? The second watch is the nursing watch that you use. Can I have any watch, please? The watch which is working. Let's hope it's working. Anyone with the watch which is working? Or is working? It's okay. So we need the watch, methylated spirit, then KY jelly, especially. So for the KY jelly, we use the KY jelly if we are using the rectal when we are getting from the rectum, isn't it? Okay. Then observation chart. So the observation chart is the TPR, which is just on top of the trolley. Then the other thing, if you have been assigned to check also. Okay. So if you have been assigned to take also the blood pressure, we are going to use the digital. In hospitals, you are going to find the digital. But here you are going to find, we are using the manual, okay? And that manual, we call it a sphygmomanometer. Sphygmomanometer. It has, the name is difficult to pronounce, but continue pronouncing it, you'll be an expert in that. Eh? Then you also need the stethoscope. So now, when you look at that, the setting, then the bottom shelf, that's where you're going to put now, what is the receiver? That receiver, when you clean the armpits, right? The axilla, when you clean the axilla, you clean the thermometer, all the dead swabs are going to be where? To be thrown there. Are we together? So this is what we are going to do. So we call it as TPR, so we are going to start with temperature, pulse, respirations, and what? The blood pressure. So the temperature, we are going to use the axilla to check for the temperature. Then for the pulse, we are going to use this part, isn't it? What really is this part is? Hello? The radio. We have put in the radio. So we are going to check from here, okay? Then for the respirations, we are going to check. We look at the rise and the falling of the chest. Are we together? Then for blood pressure, we are going to use now the Sphigy, which is now there in the stethoscope. Are we ready? We can start the procedure? Yes. So we'll do it in a procedure way, but I'll be talking so that you can follow it closely. Are we together? Yes. So I'll wash my hands, go to the ward manager. So this is the ward manager or the ward in charge, isn't it? The one of the now the patient is seated so comfortable. The patient is seated so comfortable. No wonder I gave you this so that you can lean on it. Okay. You wanted to rest? Okay. All right. So, good morning, madam. I'm student Munya from Rusam University, and I've been assigned to check the vitals on patient number 5, who is Mr. Chibu Vieira. Can I go ahead? So now, remember, you have to come with what? The file of the patient, isn't it? Okay, now, when I'm done with that, what do I do next? I need to go to the patient, isn't it? I'll go with the file. Okay? Sorry, so this is the file. I need to come to the patient. Good morning, sir.
Morning, sir.
I'm alright. So, I'm student Mwenya from Rusam University, and I've been assigned to take vitals at 14 hours as they are due. I'm supposed to take the vitals, temperature, respiration, pulse, and blood pressure so that we can check how you're faring with the treatment, if the treatment is working well. So these, they are going to help us to know if the treatment is working well. Is it okay? I can go ahead.
Yes, sir.
So now the patient, I've explained the reason why I'm taking the vitals, isn't it? I've given the rationale. The patient has the right to refuse, that don't take the vitals from me, it's okay, I'm okay, just like that. Okay? So the next thing that I'm going to do is to do what? This particular patient, probably the patient, we are saying the patient is on the ward, isn't it? So what am I going to do? I need to assess the patient. If there is anything that I'm supposed to do, isn't it? So now, during assessment, you remember during assessment, that's when now you can do what? You can wash your hands, you glove it, isn't it? I am coming to the patient to see where is the patient sleeping from. How is the linen? Is the bed made? Is the bed not made? Isn't it? The general condition of the patient, I'm assessing the patient. The general condition of the patient to see if the patient is responding or the patient is not responding. Are we together? Now, after that, that's when now I tell the patient, during the patient assessment or during the patient preparation, I need to tell the patient how I need the patient to be. So for example, I've already sent the patient the patient will be in this position. This position is what? The positions we did in the morning, this is the what? So this is the same fowler's position, isn't it? So the patient will be here, and I tell the patient, I will screen for what? For privacy. Even if you're taking vitals, it doesn't necessarily mean that you don't have to screen for privacy. So I will screen for what? For privacy. Okay? Now, I tell the patient, I'm going to prepare the what? The trolley or the equipment. So now when I go and start preparing the equipment, what do I need? I need this, isn't it? Okay? I need the galley pot, I need the bowl of swab, the gauze, then we have water, the distilled water, so that I can now use it for cleaning the water, the thermometer, isn't it? Then I also need the spirit, isn't it? Okay, now I need the temperature, the thermometer, isn't it? I need the thermometer, so we have two for reading purposes, then we have the mercury one. I need the stethoscope so that I can do what? I can take the blood pressure. I also need the what? The sphygmomanometer, isn't it? Now, when you have these, I also put the tray, the receiver for used swabs. So now I am preparing, isn't it? Before I prepare, what do? I need to do what? The hand washing, isn't it? So for hygienic purposes, we do the hand washing. But you, since you are student, you're supposed to do the proper hand washing, not the hand sanitizer. You go that side, and I'm pretty sure everyone, before you came in, you did everything. So what do I need? I need the water, isn't it? This water is for cleaning the water, the thermometer, because I'm using this thermometer for the first time, isn't it, on this patient. If I am going to another patient, that's when I'm going to use the water, the spirit, right? Okay. So now, when I'm done with that, I need to prepare the water, the swabs, isn't it? I'm supposed to prepare the swabs. Okay. Can I have a small receiver, a very small receiver from there? Okay. Okay, so I'm going to put this. So here you just need one, isn't it? You just need one. Then I need to prepare the what? The gauze for me to clean the what? The axilla. Don't say the armpit. The axilla, Yes. You are senior students now. Okay? Just like that. Okay. Now, the next thing that we are going to do is to go back to the patient, isn't it? So I come to the patient. Okay? So, good morning, sir. I am back so that we can now take the vitals. So, I'm going to take the temperature from the auxiliary. I don't know, do we understand these terms? If the patient doesn't understand, you use the terms they are comfortable with. So I'm going to get from the auxiliary, then I need also to take the pulse. And now, when you are using the thermometer, you wait for 3 to 5 minutes. Are we together? So when you get this thermometer, you press this button, it's on, isn't it? So this one is on, okay? So now we clean it while it's off. Are we together? So I'll get this one and just clean this part. Are we together? Okay? Now, after preparing for this, I need now to expose this particular patient, right? But before I expose the patient, what we are going to do is to get now the prepared water gauze, isn't it? And what do? I need to tell the patient that I need to clean. Are we together? Sorry, I'm not cleaning, don't worry, okay? So I'll clean like that. I throw it. Then I get now the thermometer, which is already cleaned. I put it where? I reset it, then I put it in the armpits like that. Not the armpits, the auxiliary. Then I'll tell the patient to do like this, okay? Yes. Then we start now waiting. This one, once it is just 3 minutes, it will tell us the readings. Are we together? The next thing that I'm going to do is to use now the other hand, which is not working, isn't it? Where we haven't. So now what do? When getting the temperature, okay? When they're getting the temperature, it is there in the auxiliary. But when I'm getting the pulse, I am getting from this part. So I will follow the thumb. Where we are having the joint, that's where I'm going to do what? To press, isn't it? Okay? So now, I need to use the what? The watch for a minute. The pulse for a minute, right? So now I'm filling the pulse here, so I need to start now counting, okay? It has even given us the sign that it's ready, isn't it? Okay? Okay. So now it has given me the pulse is giving you that they have 63, isn't it? Normal pulse is between 60 to 100, isn't it? So anything between this is normal. Are we together? So the normal pulse has given me as what? 63. Okay? Then it's now beat per minute, it's BM. Okay? Then the temperature, can you read what is it? Can you read what is it?
It is 6.5.
So the temperature is given us to be 36.5. So what do? I need to record. Are we together?
Yes.
This one is not going direct there. I need to clean it before I pack it. Okay? So I'll get this. I clean it. Then I take it back. Then, now when you look at the normalities, we are saying we use blue pen for what? For normalities, isn't it? So now I am going, when you look at this, right, we are saying it's at 14. I've already asked the patient that did the patient pass by, or the patient went to the toilet, or the patient said yes, isn't it? So I'm just going to tick here, because it is at 14 hours, okay? Then the temperature was what? What was the temperature?
36.
So that's 6.5, isn't it? When you look at this, it is 35, 36, isn't it? Now, when you start counting, this is 35.0, 0.1, 0.2, 0.3, 0.4, 0.5, 0.6, 0.7, 0.8, 0.9. Then here we have 36, isn't it? So now, when we start from 36, okay, we are going to 14 hours here. Then 36.1, 0.2, 0.3, 0.4, 0.5, isn't it? So I am going to put a dot there. Are we together? I will not write anything. I will just put the dot. Then there is the pulse. What was the pulse? 63, isn't it? Pulse is down here, and down there I'm going to write 63, okay, for the pulse. The next thing that I'm supposed to do now is to do what? To check the what? The respirations. How do we check the respirations? We look, or we check for the rising and the falling of the chest, okay? The patient is not supposed to be aware of whatever you are doing on the respirations, okay? Just put the patient at ease, okay? Just put the patient at ease. Now, I need to start now checking using the what? The watch. Are we together? Okay. Using the watch, I need now to start checking the rising and the falling of the chest, okay? So as the patient is breathing in, I start now. So it is also supposed to be under 1 minute. Are we together? Under 1 minute. So for example, when you are checking, the patient gives us something to do with, for example, 15, isn't it? Okay, 15. Depending on the condition, the patient gives us 15. What are we going to do? 15 is within the normal range, isn't it? Because we are saying the respiration is between what? 12 and what? 20. And you also need to understand that when we are talking about 12 to 20, that one will also lead you to know how many liters of oxygen are you going to give that particular patient. It's very important to take the pulse, the respirations, because we are talking about also the what? The tidal volume. Are we together? That tidal volume, the gases that remains within the what? The gases that are remaining within the lungs after the expiration has been done, isn't it? Inspiration and expiration, we have 0.5 liters of the gases that remains where? In the chest or in the lungs. Now, when they remain in the lungs, they are going to help us to know if the patient is having difficulties in breathing, how much should we give? How many liters of oxygen should we give? So we are going to say that 0.5, are we together? Times the respirations, which is 15. Are we together? It is giving us what? 7.5. And that 7.5 is the number of liters we are going to be giving to this particular patient. Are we seeing how respiration is important to us?
Yes.
So the tidal volume times the respiration is going to give us the amount of oxygen we are supposed to give this particular patient. So if the tidal volume is 0.5, which is 500 mils, and the patient is respiration, probably the patient respiration is 24. You are going to calculate 24 times 0.5 liters of tidal volume is what? Half of 24 is what? 12, isn't it? So you'll be giving 12 liters for what? 12 liters of oxygen per minute to this particular patient so that we can help the patient recover. Are we together? So upon finishing that, I need to record, okay? We are saying the patient has 15, isn't it? Okay, 15. So down here there is the patient, today is 16th, right? 02, 6, 15. The next thing that I need now, at this point I want you to concentrate, please. Otherwise you will kill my patient. I need you to concentrate. We need to take the last major vital sign. And this major vital sign is the blood pressure. So how do we get the blood pressure? We are using the SFIG, isn't it? This and the stethoscope. Are we together? Are taking vitals difficult? Do you know that you can take vitals within 5 minutes on a patient? Yes. So we need the stethoscope. So this is the stethoscope, right? This stethoscope, we need to clean it with the spirit. Okay? You need to clean this. Are we together? That's when you can put it where? To your eye, your ears. Are we together? Then this is the what? The diaphragm. Okay? This is the diaphragm. We call it a diaphragm. It's the one which goes direct onto the patient's skin so that we can check on the brachial plexus. Okay? The brachial artery. That's where we get all these things. Okay? So now, remember this one is cleaned, right? The next thing that I'm going to get is the what? The BPOT machine, the manual one. Okay? This is the manual one. Okay? Now, how do we check that it is working? We have the gauge here, okay? This gauge, don't look at it like it's not working. It has to work, isn't it? Okay? So, let me close it, then you see how it is. So, when I see that it is increasing like that, okay? The readings are going up, then I know that it is working, isn't it? Okay? It is working, so this one is working. Now, I need to what? To inflate it first. Okay, we need to deflate it like that. So that everything is at T0. Everything should be at T0. Okay? Now, when you look at this curve, there is the index large adult size. So this one is for what? For adults. Okay? For neonates or pediatrics, you still have a different one, isn't it? So when you look at these two tubes, they are going direct onto the what? The blood vessels, okay? So now what do we do before we put there? The patient, this is the last thing you take. You can take temperature when the patient is still gasping or the patient is still running, okay? But for this one, you need to wait. When the heart is at ease, that's when you can take the blood pressure, okay? So the first thing that I'm going to do is, I'll get the hand of the patient, isn't it? The hand of the patient is supposed to be at ease. So let me just reduce, let me just do this. Okay, then probably I can do this so that we can just make sure that the patient, now when you look at the patient, right? So we put now on the brachial plexus, you put now 2 inches, okay? Just like that, okay? Then on top, that's why you're going to put that cuff. Are we together? Okay, on top, that's why you're going to put the cuff. Now, when you look at this, the artery we want, the artery is just here, the brachial artery. That's why we are supposed to feel the pulse. So the moment you just feel the pulse, then you know that this is where I'm going to place the what? The diaphragm of the what? The stethoscope. So how do we do it? I will get first the what? The BP curve, right? I'll put it on top like that. And these, they are supposed to be where? Here, because we said you have calculated, isn't it? Okay, so the shape can go up like that. Then I curve it like that. Okay? Okay, this should come to this part, then it goes. It shouldn't be too tight. Are we together? This is a little bit painful, okay? So when it is like that, then I need to check, okay? I need to check, after closing it like that, I need to check if it is working. So it is what? It is working, okay? Then I open this. it comes back to 0, okay? I check if it is okay. Then what do I do after cleaning this, okay? I need to clean this. If it has been used by someone, I also clean the other part, isn't it? When it is ready, then I'll get this. Then I insert them like that, eh? Then I feel. So I'm able to feel the pulse, is it? I'm able to feel the sound that is being, produced. This one has there's something that is missing, but it's supposed to have everything, isn't it? Now, when I'm pressing on top there, I am going to press here, where I felt the pulse. Okay? So now, when you are getting this, when I start now pushing in, okay? When I start pushing in, at somewhere 80, 90 millimeter of mercury, I'll start feeling the pulse, isn't it? That pulse. Because when I put it there, I will not feel any pulse. I won't get. But when I start inflating, okay, I start now pumping in, I pump in. At 100, I'll start feeling the pulse, okay? It is pumping. That is the pulse I'm getting from the brachial, isn't it? Now, the moment I stop feeling that pulse, okay, I cannot detect the pulse. I need to add, if I started maybe, if this gauge is giving me to say 120, I couldn't feel anything. I need to add 10 millimeter of mercury or 20, so 10 to 20, it's okay. Then you start now reducing, you open this valve, isn't it? When you open the valve, then it should now, you're opening very slowly, so that you get the first beat. Are we together? The first beat will become the systolic. And when you are opening, it is coming down. The beat that you are getting, it will start now going slowly, it will be now shallow, okay? The moment you stop hearing that, you stop now getting the beat, then it means now that is now the what? The diastolic. So when you get the beat, that is the what? Systolic. When the last beat you get, that is the diastolic. Are we together? Can we do it? Okay, so this is the patient I'm supposed to get now. Okay, so I'll get the diaphragm, I put it on the brachial plexus. Okay, I need to pay much attention. Then this one, it will go on top so that I'm able to read, to get the readings. Okay, so it will go on top like that. Then I close. I need to close so that. Okay, so now. So now, I am able to feel, I've stopped now getting the beat, isn't it? So I'll just add 20 or 10 to 20 millimeter of mercury. Then I just open a little bit. Okay? So I'll start seeing the gauge going down. Okay. So the first beat, I've gotten it at 115, okay? 115, then okay, so from my findings, the first beat, I got it at 150. In the second beat, I'm getting at 78. So that is now the diastolic, isn't it? So how are you going to record? You're going to record as 115 over what? 78. That one is normal. Are we together? It is normal. Because we are saying from 60 to 90, it's okay, it's normal, okay? Then for systolic, when you start from 90 to 120, it's still normal. After 120, everything starts now worrying. Are we together? So how am I going to record? This one I'm supposed to pack. Then I do what? I deflate up to the last. Then I remove the cuff. Okay? When I remove the cuff, I need to prepare or to put it back in the same bag where I got it from. Then I record. So how am I going to record now? When you are looking, when you see this, where I put the temperature, isn't it? The same line along the temperature, okay? That's where I'm going to write the what? The blood pressure. So what was the blood pressure? 115 over 70, 80 millimeter of what? Mercury, isn't it? So if it was 145 over 120, I would have written the what? I would have used the what? The red pen, isn't it? So this is how we get. Now, can I have some? Can we do the written demo later? We'll do the written demo later, isn't it? Tomorrow, that's the first thing that we are going to get. So this is how we get the what? The vitals. When you are done with the vitals on a patient, the next thing is to do what? To go with the file, right? I'm going back to the ward in charge and report my findings, right? I will thank the patient first for what? For cooperation. Tell him the findings, that all the findings are within the normal range, right? The next thing, I need to go back to who? To the ward in charge, okay? Good afternoon once more, madam. So I am done with the vitals from the vitals I got on Mr. Chiku, who has asthma. And the vitals within the normal range, the temperature is 36.5, the respiration, I got 15, the pulse, 63 beats per minute, then the respiration, that was 15 breath per minute. It's BM, but pulse is for beats per minute, then respiration, breath. That's the breath per minute, isn't it? Then the blood pressure has given me 115 over 78 millimeter of mercury. So these are the findings that I've gotten. They are within the normal ranges. Thank you so much. After that, I need to dismantle everything and what? Discard. Are we together?
Yes.
Okay, good. So that's how we get the vital signs in the patient.